Good night, everyone. Welcome back to one of our webinars. I want to start thanking brightbud.com for sponsoring them. Also, you for being here. I would like to remind you that throughout the presentation, your microphones are going to be muted, and we're going to give some time at the end for you to ask some questions. If you are not watching this webinar live, or maybe you have questions by the end of the webinar, you can go into brightbud.com and record a video question, and me, Dr. Martinez, or somebody else that is trained and knows the answer will answer those questions for you. I think we should begin again. These webinars come from my and Dr. Martinez's medical experience, but they do not replace a medical consultation. So here we go. So for those of you who are new, my name is Dr. Jaime Mesa. Together with me is Dr. Luz Martinez. We're both medical doctors who specializes in chronic conditions. Today we're going to be talking about leukemia, or leukemias to be more exact or more precise, which is a very, very interesting topic and probably a little unknown for most people. I always like to start talking about certain numbers just to give us a little perspective. 1.5% of people in the United States will be diagnosed with a type of leukemia this year, and of course I'm meaning 2017. So 1.5 is a lot. More than 357,000 people already live with leukemia in the United States. Of these 357,000, not everybody has symptoms or is chronically fighting against leukemia, let's say like that. Some of them are in remission, but anyways are still under the diagnosis of leukemia. 40% of those who are diagnosed with leukemia or some type of leukemia will not survive more than 5 years. So unfortunately, maybe when you see numbers, is not a condition that many people have, but unfortunately those who have it will most of them, or a big percentage, will lose their lives. So it is very, very, very important, especially because of the population that it population of people that have it. We'll talk about that later. I always also like to start with some amazing facts. And since we're talking about leukemia, which basically refers to blood, I would like to start with some amazing fact. We all seen, and now it's very famous, this character called the Wolverine, in which, for those of you who don't know, it has, by a certain procedure, his skeleton has been replaced with a metal. So he basically can endure a lot of damage and a lot of weight without breaking bones, because basically now his bones are metal. And I was, every now and then when I talk about this with certain people, even patients, they ask me, well, if now we replace hips and certain other bones with some metals, wouldn't it be possible to replace the whole body with the whole bones, I mean, with metal? Well, the answer is no, because bones are not only hard white things that are made to support. Actually, bone marrow, which is the core, the center of the bone, produce and creates the blood cells. So basically, if you replace those bones with something else, you wouldn't be able to produce any more blood, and you die, basically. And we have to understand that at least red blood cells, they live around 3 to 4 months. So basically, if you do that, you'll have basically 3 or 4 months left to live. So bones here, the amazing fact about it is that bones are a little bit more than just support and strength. They actually have a very, very, very important, crucial, and vital task in the body.
So now let's talk about what is leukemia. Leukemia is mainly a type of blood cancer. There are many types of blood cancer that normally they damage two type of organs. First, we have the bone marrow. As Dr. Mesa mentioned, it is in all our bones. Here in bone marrow, most of blood cells are made in here and take a process of maturation here. And in blood cancer, we can also have damage the lymphatic system that works, makes the transport of those blood cells. So it is so important. But here in leukemia, bone marrow will be the organ that will be damaged. In bone marrow, normally we have the production of two type of, of cells, of two type of lines. The first will be the white blood cells. Normally they help us attacking infections mainly. And the red blood cells, there are many types of red blood cells, but the two main will be erythrocytes that, as you know, help us carry the oxygen to all our tissues and all our body. And the second one will be the platelets that help us controlling the bleeding when you have an injury. So a patient with leukemia uh, or the leukemia consists in the abnormal growth of this type of cells, just one type of the lines I have mentioned. Here in the picture, we show an example of the white line cells that are the most common affected. And these cells that are overgrowing just grow and grow continuously without dying as they had to. These type of cells that are immature crowd up the normal cells that will have to be here, the bone marrow. So we will not have enough cells, normal cells, to carry oxygen, to fight infections and control bleeding. That's the main thing that happens here in leukemia.
So in a certain way, or in reality, leukemia is not different from the other types of cancer we have mentioned before or we've talked about before. It's just an abnormal division and copying of cells, in this case, the cells of the bone marrow. So basically, one cell start to overgrow and reproduce more than the rest. So basically, it displaces the rest of the normal cells. And these cells, the ones that are overgrowing, they don't, as Dr. Martinez was mentioning, they don't function as normal cells, because a normal white blood cell defends our bodies from different attacks, but a damage or an abnormal blood cell basically will, first of all, it will live longer, and it will not be able to fulfill its function. So our body, even we will have a lot of white blood cells, our body will be more exposed or with a higher risk of getting infection. So basically, we've got a lot of white blood cells that are useful. I mean, not useful, sorry, useless.
So sorry, I had a connection problem. Can you hear me?
Yes.
Okay, now. So what are the risk factors of leukemia? First, we have people who have been treated for previous cancer treatments, another type of cancers, with radio or chemotherapy drugs. Some genetic disorders, for example, Down syndrome is one of the most risk factors for having leukemia. Exposure to certain chemicals, for example, the most important will be the benzene, that is a normal compound of gasoline. Smoking cigarette, as in all cancers we have seen webinars, is one of the risk factors. And of course, having a family history or relative with leukemia, because some types of leukemia has a genetic disorder that is proved. So having a relative will be a risk factor.
Yes, and regarding the benzene that Dr. Martinez was mentioning, it is also related with smoking, because benzene is also found in cigarettes. probably more, or at least maybe not more in concentration than in gasoline and other products, but definitely people that are exposed to cigarette are more exposed to that smoke than that what they're exposed to gasoline or other chemicals. So that is the reason why smoking is such a high risk for this, not only for other cancers as we have mentioned before, but for this especially.
So let's see the types of leukemia. It depends on the line of cells that is compromised. We have both types of leukemia, the lymphocytic and the myeloid leukemia. Lymphocytic means that the white blood cells are damaged, and myeloid leukemia means that red blood cells mainly are damaged. Here we can see the percentage of the types of leukemia. There are four main types. We have the acute lymphocytic leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, and acute myeloid leukemia. So as you can see, the most frequent one is the chronic lymphocytic leukemia, and the last, fortunately, is the acute lymphocytic leukemia. The mean age of diagnosis of this one will be 14 years. For chronic myeloid leukemia will be 64, for acute myeloid leukemia 67, and for chronic lymphocytic leukemia will be 71. And as you can see, both acute lymphocytic and chronic lymphocytic are in the edges of age. 14, acute lymphocytic leukemia is the most common cancer and blood cancer type in children, and the chronic lymphocytic leukemia is always seen in the elderly people.
Yes, so basically, uh, when we're talking about leukemias, and these are like the most common, you can see that 15% are other types of leukemia because they're very, I mean, there are a lot. So these are just the main ones, but you can see that basically we have chronic and acute. Just for you to know, of course, acute leukemia, both lymphocytic and myeloid, they are a little bit more aggressive, or not a little, they're actually a lot more aggressive than the chronics, because as the word says, chronic take time, and in some patients they don't even need treatment at all. But acute, they develop so fast that they really produce a lot of symptoms and a lot of mortality. And unfortunately, as Dr. Martinez was saying, at least for acute lymphocytic leukemia, children are the ones that are affected the most. So that's why you see a lot of, I mean, if you see a child with cancer, the probability of him having leukemia is very high. Probably the most children that have cancer have this type. So it's very heartbreaking, and that's also why it is very important.
Yes. So now the symptoms of leukemia. Because it is a blood disease, it can cause many types of symptoms. They are unspecific, so it makes it difficult to make the diagnosis. But mainly, as I mentioned, if you have compromise of the erythrocytes that carry the oxygen to your body, you will have shortness of breath. If you have low platelets, as these people with leukemia, you will have easy bleeding or easy bruising, are purple patches or spots in your skin. Some people suffer weight loss, fevers that can be treated, frequent infections because you have your your immune levels diminish because of the treatment and because of the disease itself. So if you have a couple of these symptoms, add to any risk factors, we recommend you to seek your medical doctor just to rule out this diagnosis that is so important.
Yes, I mean, there's so many possible symptoms that it's actually very difficult to say what's a typical case of a patient with leukemia, even for doctors. But if I needed to say the most common, or the ones that we would like you to remember, would be night sweats, um, losing weight involuntarily, of course. Uh, I would say that together with probably the fatigue, uh, or shortness of breath, those not by themselves, but those together definitely are a sign that you need to go to a doctor, as Dr. Martinez was saying. Of course, once you go, then we will find the rest of the signs and probably other symptoms that you might have overlooked. So there we go. How do we diagnose leukemia? Well, of course, everything starts with a very thorough history and examination. It is important, as the picture is showing, to do a very good examination of the lymph nodes. The lymph nodes are certain places in the body where it's like a meeting point for the white blood cells. The lymphatic system, it's very, very similar to this to the other circulatory system. So basically, I did mention this before, but you have arteries, you have veins, and you also have lymphatic blood vessels. So basically, lymph, which is kind of a liquid, also travels to this, let's say, this highway, and it basically carries the white blood cells, the cells that are in charge of defending our bodies. So they're always getting information from different parts of the body, and they meet in these lymph nodes to share that information. So whenever they are sharing, let's say that these lymph nodes become swollen and sometimes painful. So we have them all around the body. We tend to think that they're only in the neck because they are the mostly they're more commonly inflamed. But we have under the armpits, we have it in the neck, we have it in the back of our heads, we have them in our groins, we have them in the abdomen, inside of the abdomen, also in our feet. We have them in every place of our body. So we look for that. Of course, we also would like to feel the abdomen because, as Dr. Martinez was saying, certain organs, especially the spleen, might enlarge because the spleen is a very important organ of the lymphatic system. So it might become enlarged and we might be able to feel it. We also order regular blood tests, especially complete blood counts, because of course what we're looking is any variation in certain line of that of the blood. So when we say a CBC or a complete blood count, what we mean is that we're going to take that blood and a machine will sort out the different types of cells. So it would let us know how many red blood cells do you have, how many white blood cells do you have, how many platelets do you have, and not only that, it will let us know of the white blood cells, the different subtypes. So of course, if we see something is the levels are, or the numbers are higher than expected, and some others are lower, together with some physical findings and some of your symptoms, then we might suspect leukemia. So what's the next step? We do something that is called a peripheral blood smear, which is also a blood sample, in which basically it is put on a glass slide and watched under the microscope, and very similar to the image at the beginning of the presentation when Dr. Martinez was explaining to us. Basically, here in the left, you see a normal blood smear in which you see a lot of little red or pinkish dots. Those are the red blood cells, and you see some purple ones, like 3 of them, which are white blood cells. In the right, there's a slide of a patient with leukemia. You can see that definitely those white blood cells are well increased or compared with the ones on the left. And not only that, the red blood cells, you can also see that they are diminished. There are not so many as they were as they are on the left. Once we have this is not necessarily diagnostic. We need to still do more tests. So we do with what we do with most cancers, which is a biopsy. But since blood is not a tissue but a liquid, the best sample that we can have is from the origin, which is the bone marrow. As we mentioned before, bone marrow is present in almost all of the bones, but the pelvis is a very big bone which contains a lot of marrow and is relatively easily to access with a syringe, and it's a very big syringe, but it's a syringe and a needle. So basically, by the pelvis, we get a little sample, and it's looked by a pathologist under the microscope to confirm the diagnosis. It can be, it is very specialized, so it's a pathological diagnosis. How do we treat leukemias? Well, I want you to go back when Dr. Martinez was explaining that we have different types of leukemias, because the treatment might be very, very different one leukemia to the other, especially if we are talking about chronic or acute leukemias. So it depends on the type, the stage, and what clinical features that are present in the patient. Usually with some chronic leukemias, we have to remember that since the patients are affected later in life, after 60, and this leukemia grows, let's say that so slowly, some patients do not require any treatment at all. It's also a very curious fact that the cells in the patients with chronic leukemia, they function better than the ones of an acute, because in acute processes, they divide so fast that they have a lot of defects. It's like trying to make copies and copies of paper. At the end, you will have copies of very bad quality. But when you do it chronically over a long time, when they give you time to do it, you might produce better copies. So that's why chronic patients with chronic leukemias do not have that many symptoms and can have treatments that are not necessarily so aggressive. Now, acute leukemias, of course, we do treat them with chemotherapy. Some go into remission, especially in chronic types. Some might need this more than once. They might go into remission for some years and then come back and need another sessions of chemotherapy. And for some leukemias, we might want to do a bone marrow transplant. Some patients that will require bone marrow transplant will first need chemotherapy to get rid of the abnormal cells, or as many as we can, before getting a transplant. Bone marrow transplants can be from yourself. That can happen. We might actually go into the bone marrow and then select the cells that we want and reproduce them and then put back to you when you finish chemotherapy. You can also have bone marrow from a donor, different from yourself, which is very, very used nowadays. Other possible treatments are with medications that in a certain way can be considered chemotherapy also, or not. It depends on how your own definition of chemotherapy. Now we're not only for leukemias, but for other kinds of conditions, we are talking more and more about what we call the biologicals. Biologicals are what we call monoclonal antibodies. It's a complicated thing to explain, but to try to be simple about it, antibodies are molecules that basically are designed to identify and attach themselves to something. So now we are creating these antibodies to detect many different things. So if we want to fight a virus, then we might create an antibody that detects certain part of that virus and attach to that part, or to a bacteria or something in our own bodies. In this case, for example, one of many, because there are many of these drugs that are approved, rituximab, for example, identifies certain part of this cells, of these cancerous cells, and it attaches to the outside part, making it easier for our own body to identify those cells and kill them. That's how it works. So it's a very, very good medication. Is very strong and has some potential side effects, but definitely is one of the advances of medical technology and pharmaceuticals now in the present days. We also have some other medications which are being developed that they detect some other part in the cells and basically block a certain process that will eventually lead to the cancerous cell um, basically killing itself, what we call apoptosis, which is the own cell killing itself. So we have some other medications that will make the cancerous cells kill themselves. So it's very, very interesting. One of them is Gleevec, which is oral, not like rituximab, which needs to be infused. But Gleevec is oral, so it's a very, very useful medication. Um, Here we have some common questions that some of our patients ask us. Um, for example, they ask me if can the doctor tell if you have cancer from your blood work? And of course, they mean from the regular blood work. We have to remember that many patients just go to their doctors for their annual physical and that's it. And of course, we do order some blood work, which we call routine, which are like lipids and CBC, comprehensive metabolic panel. So are we able to detect cancer? The answer is yes and no. Of course, we have to understand that these tests, these routine tests, are not designed for diagnosis of cancer. But of course, in this specific case of blood cancer, as I mentioned before, we might see abnormalities in the blood, in the complete blood cell count or complete blood count, which I mentioned before. So we might get a little heads up of what's going on, and then we order. But that would be it. For other types of cancer, is not that easy to detect them in routine lab work.
Okay, there is another really common question that a patient do ask in our consult, and is there a cure for leukemia? We normally do not like to use this term in cancer cure, but we have a complete remission that Dr. Mesa mentioned before, and it is quite common, for example, in children. It is true that they have very serious disease when it appears, but almost 80% of children with acute leukemia will have a total remission in up to 5 years. So it is really good. But in chronic leukemias, it could be a little bit different because it is less dangerous and it is a chronic disease, as the word says. To have a remission will be difficult to see because, for example, if you have leukemia and you're diagnosed at 80, it will be difficult to see for us if you are in a complete remission because the disease is very mild. So a cure will not be used, but you could have a complete remission with a normal life without any episodes for your lifetime.
Yeah, if we use the word cure, a lot of patients will never come back to get checked, and some of them, unfortunately, will undergo remission, but and then the leukemia might come back. So we just like to have a close follow up with these patients. With cancer, any type of cancer, we say that it's the only chronic condition that can be cured. We're not going to get cured of diabetes or high blood pressure or any other chronic condition, but cancer, certain types you can be. And in this case, this might be one of those, although, yeah, the term remission or complete remission is preferred. Can leukemia metastasize? That's another question. Of course, since it's blood cancer, it's difficult to imagine how can it metastasize because it's not considered a solid tumor. Well, the answer is yes. Unfortunately, leukemia can metastasize. It can even go to a certain part of the nervous system. Usually, it might go to the layers that cover the brain and the brain stem also, and it can cause other types of tumor. Is it common to see metastasis with leukemia? No, it's not very common, but it can. Some patients will need surgery once this metastasizes. And of course, if this happens, then it turns to a more aggressive and more severe condition. So it can, but it's not very, very common. Actually, it's rare.
And the last one will be leukemia. Is leukemia caused by antibiotics? And the answer will be no. There is no relation about taking or oral or IV antibiotics with leukemia. As I mentioned before, there are drugs that can cause leukemia as chemotherapy drugs, but antibiotics doesn't have anything in common because antibiotics just have a target that is maybe can be bacteria, the fungus, the virus, but can't attack your own cells. So the answer will be no.
Yeah, definitely no. Okay, thank you. Thank you very much. Now we're going to give you some time for some questions.
Doctor. Separation agreement and general release.
Yes.
How can you differentiate? You said one of the symptoms of leukemia is hot flashes. How can you differentiate the hot flashes of menopause versus leukemia?
Well, yeah, sometimes it actually might be difficult, but let's say that hot flashes, referring to, of course, a symptom of menopause, they might happen any time of the day, and you learn to know how they are. So basically, no matter what you're doing, you will start feeling the hot flashes and sweat, feeling hot. When you have the night sweats, which are a symptom of, or might be a symptom of leukemia, then basically you might actually feel the opposite, not necessarily hot, but a little cold or shivering, like if you had fever. That is what happens with leukemia. And you will have cold sweat, not necessarily the hot sweat of the hot flashes. Sometimes you, and of course you have it at night. In hot flashes, you can have them any time of the day. Those are like main differences.
And another important thing is that normally these night sweats are present with other type of signs, as Dr. Mesa mentioned before. Normally we have a couple of symptoms, not just night sweat, maybe loss of weight. So this is a really good clue to know if it is a systemic disease or is just menopause.
Okay, and another question. The surgery that you're talking about, would that be like a blood transfusion?
Well, bone marrow transplant is very similar to a blood transfusion. Basically, we take the bone marrow either from yourself or somebody else, and we try to purify it and take only the stem cells. The bone marrow is rich in stem cells, so we try to take those, and sometimes we even use the stem cells from the umbilical cords. But the idea is that we take those stem cells, we try to reproduce them when we have a big amount might look like a syringe. It doesn't necessarily have to be like microscopically talking, we are looking for a good amount. But then you just put that into your bloodstream, and those cells will travel again and eventually will sit in the bone marrow again. So if we put those cells and the blood marrow is intact, then they will not find a place where to grow back again, because the blood marrow is there. Why to go there? So that's why we first do chemotherapy, to basically remove all the bad bone marrow. And once it's empty, let's say that it's never really empty, but very, very diminished, then those cells will travel through the bloodstream and get there and start reproducing and regrowing. This is a process that sometimes takes 1, 2, 3 or more attempts, because the first transplant might not be successful and all of the cells just continue traveling through the bloodstream and never actually grow in the bone marrow. Some can do from the first attempt, and those are like the miracles and the ones that we really like to hear about. But unfortunately, some patients require more than one procedure to actually have a successful growth of stem cells in the bone marrow. But it is like a transplant. Actually, before, after getting the transplant, some patients receive a blood transfusion, because of course these cells need to travel in a liquid, and blood is very good, and because obviously the chemotherapy will create anemia and some other symptoms that they will need blood. So it is very common for you to see in a hospital a patient that has a very similar thing to a blood pack, but is maybe thinner and with not that much blood and a little darker. That might be the bone marrow. So it's very, very similar to a transfusion.
Thank you.
You're welcome.
Not all leukemia are treated with chemotherapy?
As, for example, in chronic leukemia, and specifically the lymphocytic chronic leukemia that appears too later in life, as I mentioned, the mean age of diagnosis will be 71 years. We prefer to do treatments that are not too invasive to the patient, because the life expectancy of this patient will not be really longer. This type of leukemia will not need always chemotherapy, but the other types of leukemia, normally we use chemotherapy as the first stage and as the first treatment of this disease.
Of course, there is where I would say that depends on your own definition of chemotherapy, because even in some books of pharmacology, antibiotics are listed under chemotherapy, because chemotherapy basically are chemical products that we use as a therapy, as a treatment. But as years have passed, we have used that term exclusively for certain medications used in cancer. So basically, when we think about chemotherapy, we basically think of a person that is receiving IV medications that will lose hair, that will start having secondary effects like vomit and having like not a very good time. That's our conception of chemotherapy. And when we are talking about that, then the answer is no, not all the patients will require that type of chemotherapy. Every patient will require medical treatment and medications usually, but not all of them will require that aggressive. Some patients will need one of those medications that I mentioned, that they are oral pills and they will need it once a day, for example. It's also in a wide way considered chemotherapy, but in the traditional and widely concept, it's not that such harsh chemotherapy. I don't know if I explained myself.
Yes. Thank you.
You're welcome.
Dr. Mesa,
Yes.
the needle biopsy that you do for the leukemia, is that only, and it's done in the pelvic area, is that only used to check for leukemia, or can it be for other cancers too?
It's mainly used for leukemia, and not necessarily there. It can be, we just need bone marrow. It can be taken from other places like the sternum here, the chest, but usually it is used for leukemia because some other types of tumors or cancers, well, do not affect the bone marrow. We can do it for lymphomas. It might be useful in certain lymphomas just as a secondary way of diagnosing. And maybe we can do similar procedures, but not necessarily to do a bone marrow aspiration or biopsy. But for example, if you have a bone tumor that is located in the hip, we might use a needle in a very similar process to take a biopsy of that place, and certain people or certain person might be confused. Maybe they thought it was for blood for leukemia, but it wasn't. But mainly we use it for leukemia.
There is also another disease that is called multiple myeloma.
Oh,
That
wow.
is also a type of blood cancer, and we use bone marrow aspiration for this type of cancer. But yes, as Dr. Mesa mentioned.
Correct. I stand corrected. I mean, we use it for blood cancers. Sorry, I said leukemias, but I meant blood cancers, which leukemia is one kind, but we also have some others, being multiple myeloma, one of those. Yeah, correct.
Thank you.
Very good question. I love that question.
Yes.
Doctors, the when you extract the bone marrow from a donor, is it more or less a similar process to the needle biopsy? Is it something like that? Or?
Yes, it's a similar process, but the difference is the amount of marrow that we're gonna get. Of course, when we need a donor, we would like to have a very big sample, not such as small as the biopsy, because not all the cells in the marrow are going to be used. We need the stem cells. So the sample that we get, we're only going to choose a few of them to actually reproduce and then do the transplant. So the process is very similar. We also do it through the hip. That's the bone we prefer. As I mentioned, it can be done in other bones like the breastplate here, the breastbone, or the sternum as we call it. They're very similar, but the amount of marrow that we use is what makes the difference.
Okay, thank you. Does leukemia affect your bone structure at all?
Yes, one of the symptoms could be even bone pain, because there is as I told you, an abnormal increase of cells, and they may be a million of cells, and there is an increase of the tissue, and it can make your bones to pain and also weaker as normal. Yes.
Yeah, the bone marrow basically it's a hole in the middle of the bones, especially the long bones, like the ones in the arms, the legs, and in the middle of those bones, basically a spongy tissue grows, which is the bone marrow. But if it's normal, then that space will not grow and will have like the adequate space, as I mentioned. But if it grows uncontrollably, then this marrow will displace the bone or will fill it in so much that it might actually cause this pain and fragility. So the bones might be brittle, you'll have pain, and other bone symptoms. Pain is actually very, very, very common.
For example, in multiple myeloma, not in leukemia, but one of the symptoms are the bone fractures, and yes, and the ribs will be the first one. So yes.
Okay, thank you.
You're welcome.
Okay.
Is the survival rate for leukemia high? And if so, is it changing over time as like technology and the sciences progress?
Definitely. I mean, now, as I mentioned before, just in general, mortality it's about 40% in 5 years. That's taking all of the leukemias together. As you saw before, as Dr. Martinez was mentioning, some leukemias are more or are less deathly than others. The mortality is lower. But definitely, the advances in science are the ones that are actually helping us modify those numbers. Let's take the best example here, that would be acute leukemias in children, for example. Now, Dr. Martinez said a different number that is a contrast with the 40% that I said, in which more than a half or even 70 or more of those patients will go to remission. And that is only because of, well, number one is bone marrow transplant, which of course is great advance in technology. We've had them since for quite a time now, but now we've starting to perfect the process of cultivating the stem cells, and now we can get them from different places. As I mentioned, for example, the umbilical cord, which we didn't do before. So definitely technology, medical technology is changing these numbers. And the medications, these medications that I mentioned, they have not been in use for, I would say, more than 10 years. So this is definitely changing the numbers, and hopefully we're going to get a definite cure in the next 20 or even less years. If I would say that's possibility, hopefully.
What can be done if the leukemia does not respond to treatment?
It is quite common. We have a lot of remissions in many patients. They will need, as Dr. Mesa said before, different bone marrow transplants. We can have as many as we need. We have also different types of chemotherapy drugs that we can use, but it is quite common, and our unresponsive leukemia in chronic adults and in acute adults forms.
Yeah, basically it's a matter of persistence, I would say. Bone marrow transplant is one of those treatments, as Dr. Martinez mentioned, that we try to do again and again. Of course, it's not as easy as it sounds. I wish it would be like that, but of course, undergoing a bone marrow transplant, especially if you're a 4-year-old, 5, 6, it's very, very, I mean, it's a very hard process. We would like to do it 4 or 5 times if the patient needs it, but of course, that is very, very difficult. We have to remember that basically we have to kill, in a certain way, all the immune system before actually putting a new one, which is basically what we do in the bone marrow transplant. So you are very prone to infections in the meantime, and unfortunately, some of our patients will have some of those infections and will die of that in the process of getting the cure. So being persistent and searching for the right transplant, the right donor, and the right cells is something that we do. Before we had so many, I mean, our possibilities were so limited that we had very few donors. Now we try to seek family members, we try to seek newborns, and actually we've heard of stories of families having children just to, or in a certain way, to help them with bone marrow transplants, just to harvest the blood cells of the umbilical cord or of that newborn baby, which everything is a possibility in this when we're dealing with such a difficult condition as leukemia. Persistence, I would say, and that's the key. That's it.
How can a parent determine whether or not their child is, if their child is in remission? How can they determine whether or not it's permanent or temporary? And I mean, and does every parent have to worry that that a recurrence is possible?
Yes, a recurrence is always possible, but we say, and we have the term that is complete recurrence. Sorry, complete
Remission.
remission of the disease if we have no symptoms for a period of 5 years. So this is the definition of complete remission we have nowadays.
Yeah. So basically, what the term complete remission says in a certain way is that, or why we use it is that we've seen that after these 5 years without any symptom or any blood abnormality, the percentage of patients, not only children, but patients that will get the leukemia back are going to be very, very small. So that is a period of time in which we feel safe to say that this patient is in complete remission. Anyways, we will still do follow-ups on these patients, but not necessarily that close follow-ups. Before that, I mean, if you're still on that 5-year period, then you should never think that the child or the patient is cured, because unfortunately that might cause us to detect the disease late and not be able to treat it appropriately. Okay. Thank you very much for your attention. Your questions were great. See you in our next webinar, and have a very, very good night. Thank you, Dr. Martinez.
Thank you.
Good night. Thank you.
Bye, everyone.